Weight gain, low energy, lack of interest, these are all normal signs of aging.
As we imagine better health care with CHI Health, why accept normal when you can experience an optimal aging experience?
Dr. Gina Harper-Harrison is an OBGYN and a hormone replacement specialist. Doctor, thanks for coming on The Blend this morning. Good to see you.
Thank you for having me.
Thanks for being here. One of the things we're talking about today specifically involves women and menopause, and this is really your specialty.
It is.
So I guess you're passionate about helping women navigate these issues. Why is that?
We call it the menopause transition. I call it to my patient no man's land, and this refers to you because
you're looking right at me.
So no man understands it, and no man wants to go there.
No, but men.
Mike's going there today.
Yes, you are.
I am going there.
Yes, you are.
Because men deal with this whether they want to or not.
Absolutely. If you have a loved one who's going through a menopause transition, you're there with your mother, your daughter, your wife. So the menopause transition is different for everybody. Some people go through it rather gracefully. Some people really need my help. The average age is 51, but some people even go through it in their mid-40s.
Wow. A lot of people think about hot flashes, trouble sleeping. What are some of those short-term symptoms?
So probably the thing that I get asked for help with the most is the sleep and the hot flash and the night sweat, because it just makes you feel crummy and it affects your whole day. Those things can be fixed with some lifestyle changes first. I always go with that first. We got to optimize diet, exercise, the good old-fashioned stuff. But sometimes it goes more than that. You really need my help with nutrition, supplements, and even sometimes hormonal therapy.
Yeah. Long-term symptoms, though, I mean, those are short-term ramifications, the hot flashes, the fatigue. What about the long-term effects?
Really, that's my ultimate goal, right? I always tell my patients, if you only knew you had to suffer from a hot flash for 10 minutes, you can do it. But what happens if it's for years, and what's the consequence of the lifetime? Really, my ultimate goal is to help protect women against bone loss, against cardiovascular disease, breast health, dementia. Really, that's my long-term goal.
Wow. We talked about this a little bit. Normal. Aging is normal. These things are normal for women. But there's a way to do this in an optimal way. How can you make that experience shift from normal to optimal?
I think that's what everybody assumes, is that it's normal to age and to decline, and it is normal to age and decline, but it's not necessarily something we have to take sitting down. I really think we should try to optimize the best that we can so that your health is optimal, so that you feel good, but also to prevent long-term disease down the road. So I always tell my patients, my goal is to add life to your years, and maybe a couple extra years to your life, to make it as best as you can.
Yeah, absolutely. And I guess this has really come down to a science, hasn't it? Especially when we're talking about hormones. And I guess it can start with a lab test. I mean, because scientifically, you know the exact levels that a woman should be at.
Whenever I see a patient for the first time, I start with a humongous lab panel. I look at everything. I look at the ovary, I look at the thyroid, I look at the adrenal gland, I look at the pancreas, I look at it all. I think some people assume that it's just an ovarian problem, but sometimes it's something else. So I always start with a complete history and physical and move on to a lab assessment and go from there.
At what point should someone come see you?
Whenever they need my help. They can see me. I saw a woman yesterday, 29.
Wow.
Now, she didn't have as many hormonal things as she thought she did, but that's what really she thought she had.
She wasn't going into menopause at this point, was she?
Thankfully, no, because she still wants to have children, but I've seen 20-year-olds. I would say the majority of my patients really start to come see me right in their 40s.
Yeah. Hormone replacement, how can this help somebody? What does it achieve? What are the impact of that?
So as we age, we lose hormonal function. Men do too, so you better be careful. So
keep an eye out.
Yeah, I'm telling you, it's no man's land too for you. It's normal to age and to have decline in hormonal function and all of our function. So the idea is to try to optimize. I never tell people I can never prevent aging. I can't do that. I'm not that good. But my goal is to try to bring the hormonal function back as best as I can so that chronic disease doesn't set into the future, I guess.
What is hormone replacement therapy? Is it a drug? How do people experience it, or how do they do it?
So I think people assume that hormones are pills, and in many cases they are, but hormones, whether it be ovarian hormones, thyroid hormones, adrenal hormones, are available in a variety of different ways. We have creams, we have vaginal inserts. Sorry about that, Mike. We have.
What? I've heard the word vaginal before.
Exactly. We got to get it
make him
out there.
talk about difficult things all the time. He does
I've talked about things way more difficult than vaginas.
Exactly. But we have pellets that we place underneath the skin. We have a lot of variety of different ways of doing it.
Like you said, though, it's not just a magic pill, and sometimes it requires some deeper treatments. Maybe referring to another physician. Maybe it's diet related, or sometimes, like you said, maybe there is a prescription that can be required in this situation.
Sometimes we can manage things through lifestyle. Those people don't need my help.
Yeah.
Then I'm the referral basis for people who need a little extra more. My ultimate dream is to kind of look at it through many different specialties, through nutritional management, through health style coaching. It's easy to tell someone to lose weight and quit smoking, but if you don't give them the tools to do that well, then they're not going to succeed very well. So it's a whole gamut, it's a whole spectrum of service.
But the point is, I mean, everybody's going to age.
Correct.
Right? So, and I know you've said this before, don't be scared of the aging process.
Right.
I mean, there are things that can be done.
I think people are afraid of dying, and certainly we're all afraid of dying, but we're all going to die. The fact of the matter is we're all going to die. So my thought is to add life to your years before that happens by making your health the best it possibly can be. And I think hormone replacement definitely does that. There are some scary things out there that came out a long time ago, but there's been so much more new research that has come up that really, if done correctly, is very safe and very effective.
And like you said, aging is normal, but that doesn't mean we have to say, oh, everyone goes through this. This is just the way that it's going to be.
Yeah, and there's a lot of, women experience a lot of different things when they go through this, from what I understand.
Right.
But there's treatment options available. I think that's why you're here this morning, and that's why we do this series with CHI Health. But to get a hold of you, 402-827-4915, and if people have questions, they can give you a call and do that lab.
Please call me.
Work up the labs, right?
I start with a complete history and a complete physical and a lab assessment. Every once in a while I find things that, surprisingly, that wasn't the cause and we need to look at something else. But yes, anything I can do to help.
No
Yeah.
need to sit in silence.
Listen.
Absolutely not.
Thank you. Get to those
Thank you
patients.
so
I know
much.
you've got appointments waiting on you.
Thank you so much. Yes, I do. Thank you.
Thanks for your time.
Thank you.
Thanks, doctor. Diamonds are forever.